You've done everything right. You bought the magnesium your sister-in-law swears by. You take it the same time every night. The bottle says it's the most absorbable form on the market, and you trust that. And yet, at 3 in the morning, the cramps still wake you up, or the restless legs, or the racing thoughts that will not let your brain shut down. It's not your fault, and the pill is not the problem. After 60, something happens inside your digestive tract that quietly cancels most of that magnesium before it ever reaches the muscle, the nerve, or the heart it was supposed to protect. There is a real reason your magnesium glycinate isn't working, and it has almost nothing to do with the pill itself. By the end of this video, you'll know exactly what it is, and you'll know exactly what to do tonight to fix it. I'm Dr. Richard James. I've spent more than 3 decades watching this exact frustration play out in the patients who come into my office. They take the magnesium. They follow every recommendation. They buy the form their friends recommend. And the symptoms do not move. Not the cramps, not the sleep, not the anxiety that sits on their chest at 3 a.m. Magnesium deficiency is one of the most under-recognized problems in adults over 60. National nutrition data from the United States shows that roughly half of American adults already fall short of the dietary requirement, and the gap widens with every decade after 60. Not because magnesium is rare in the food supply, because the standard blood test misses the deficiency almost completely, and because the pills most people are taking are not the pills their aging body can actually use. Before I tell you which form does work, I need you to understand something about your digestive tract that your doctor has almost certainly never explained. Once you see this one thing, every other piece of advice you've ever read about magnesium will finally start to make sense. Here's the part nobody tells you. Your blood test for magnesium is almost certainly normal, and it can be normal while the magnesium inside your nerves and your heart muscle is dangerously low. The standard serum test catches only about 1% of the magnesium in your body. The other 99% is locked inside your cells and your bones, and that is where the deficiency actually lives. The number on the page bears almost no resemblance to the number inside your cells. Think about that for a second. You hand your doctor the bottle. They run the test. The number comes back fine. You leave the office believing you are not deficient, and meanwhile, the muscles in your calves, the smooth muscle in your arteries, the electrical conduction system in your heart, every one of them is starving for a mineral that the test does not see. I had a patient I'll call Rose. 2 full years on the same magnesium glycinate. Same brand, same dose, same time every night. Her leg cramps never improved. Her sleep never improved. And when we finally measured what mattered, we found out why. Her serum number looked fine, but the magnesium that was supposed to be inside her cells had been quietly walking out the door for months. She was 71, on a daily acid blocker for reflux, and on a blood pressure medication that pulls magnesium out through the urine. 3 forces pulling the same mineral in 3 different directions. And none of them showed up on the test her doctor ordered. Have you ever looked at your bottle and thought, maybe you just need a higher dose? You probably don't. Higher doses of a form your gut cannot absorb just give you looser stools. They do not give you more magnesium in your cells. Stay with me. Because once you understand what is actually happening at the wall of your small intestine after 60, you will never look at that bottle the same way again. But here's where it gets really interesting. The reason this pill isn't reaching your cells isn't a dose problem. It's a gate problem. And after 60, that gate is half closed. By the time you turn 65, the cells in your small intestine that are supposed to pull magnesium across the wall are running at roughly half the capacity they had at 25. There are 2 specific transport channels involved, called TRPM6 and TRPM7. Think of them as the doors that let magnesium walk from your gut into your bloodstream. Like everything else in the aging body, those doors do not open as wide as they used to. They mediate the active part of absorption, about 30% of the total. The other 70% comes from a slower, passive pathway between the cells. When the active doors slow down, that passive pathway cannot pick up the slack on its own. But here is the part that almost nobody knows. Even if those doors were wide open, the form of magnesium most people are swallowing cannot open them properly. Because by the time the pill hits your stomach, there often is not enough acid left to do the job. After 60, the rate of low stomach acid, what doctors call hypochlorhydria, climbs dramatically. And without enough acid, the chemical bond between the magnesium and the glycine in glycinate does not release cleanly. You are not absorbing the magnesium. You are absorbing the carrier and passing the mineral straight through. This is not a wellness blog. This is published, peer-reviewed gastroenterology, and it has been hiding in plain sight for years. There is more. As you age, the muscle contractions that move food through your intestines slow down, and the bacterial population in your gut shifts. Both of those things change how long the magnesium pill is in contact with the wall and how much actually crosses. Slower transit can help in some cases, but combined with the channel decline and the acid problem, it adds another layer of inefficiency. Then there are the medications. If you are over 60, there is a high probability that at least one drug on your daily list is quietly making this worse. Proton pump inhibitors, the long-term acid blockers that are sold over the counter and prescribed for years on end, shut down the very acid your stomach needs to break the magnesium bond. Long-term users have been shown in published case series to develop measurable hypomagnesemia, sometimes severe enough to land them in the hospital. Loop diuretics and thiazide diuretics, the most common blood pressure drugs in this age group, pull magnesium out through the urine. Some chemotherapy agents do the same. None of these prescriptions come with a warning label that says, "This drug will steal your magnesium," but almost all of them do. This is the part that frustrates me the most as a doctor. The science has been in the gastroenterology literature for over a decade. It just has not reached the supplement aisle. Patients keep buying the same form. Manufacturers keep printing the same label. And nobody walks them through the three things that actually decide whether the mineral gets into the cell. Think about what that means. You could be taking 400 milligrams of magnesium glycinate every night for 5 years. And at the end of those 5 years, your cells could be just as depleted as they were the day you started. 5 years of money, 5 years of effort, 5 years of trusting a bottle that was never going to deliver what it promised. That is the real cost of a problem nobody bothered to explain. Now this next part is the one that finally changes things. Because if you know the three things that make the difference, you can get more usable magnesium out of one pill than most people get out of an entire week's worth. There are 3 forms of magnesium that I see consistently working in patients over 60 in my clinic week after week. Magnesium malate, magnesium taurate, and topical magnesium chloride for the people whose gut is so compromised that nothing oral seems to land. Magnesium malate is paired with malic acid. Malic acid is mildly acidic on its own, which means the bond can release magnesium even when stomach acid is on the low side. It also feeds into the energy cycle inside your muscle cells, which is part of why patients with muscle pain and fatigue tend to feel the shift fastest. Magnesium taurate is paired with taurine, an amino acid that is concentrated in the heart muscle and the nervous system. For seniors who deal with palpitations, blood pressure creep, or sleep that never feels deep, this is often the form that lands. Taurine has its own calming effect on the nervous system, so the two work together rather than competing. Topical magnesium chloride goes through the skin. It is not a magic bullet, and the absorbed dose is smaller than what an oral form would deliver on a good day, but it bypasses the gut wall entirely. For someone with severe digestive issues who has been on acid-blocking medication for years or who has tried every oral form without relief, topical is the option that finally moves the needle. Here's one more thing. Without enough vitamin B6, none of those forms will stay where you put them. B6 is the key that unlocks the cell. Magnesium needs B6 to cross the cell membrane and stay inside the cell. Without B6, even magnesium that gets absorbed leaks back out and ends up in the toilet. Delivering magnesium without B6 is like dropping a package on the porch and walking away. By morning, it's gone. Not just any B6 either. The active form, called P5P, or pyridoxal 5-phosphate, is what your aging liver can actually use. Standard pyridoxine has to be converted, and after 60, that conversion gets less efficient. The active form skips the conversion entirely. It is a small detail with a big payoff. In a moment, I'll give you the exact protocol, the dose, the timing, what to take it with, what to avoid. But first, I need to address the question I know is already in your head. Now, I know what some of you are thinking. Your doctor showed you the number on your last blood test, and the number was fine. Here is the truth that almost no primary care office has the time to explain. The standard serum magnesium test catches only about 1% of the magnesium in your body. You can be deficient inside your cells, in your nerves, in your heart muscle, and still have a perfectly normal blood draw. If you want a better signal, ask for a red blood cell magnesium test, sometimes called an RBC magnesium. It is not perfect, but it sees inside the cell, which is exactly where the deficiency lives. The second objection I hear is this. Magnesium glycinate is supposed to be the most absorbable form. Everyone says so. And the truth is, glycinate is a high-quality form. At 45, with a healthy stomach, it works well. After 60, with declining acid and slower transit, the same pill that worked at 45 may stop working entirely. Same pill, different gut. The third objection I hear is the practical one. Isn't taking 3 different things, Nuform, B6, and an acid pairing, overcomplicated? It is actually simpler than the bottle suggests. 1 change to the form, 1 vitamin alongside, 1 small acidic food at the same meal. 3 small fixes, but they all have to be in place together. Skip any one of them, and you are back to wasting your money. I want to be honest with you about where the evidence is solid and where it is not. The bioavailability differences between magnesium forms are well documented in peer-reviewed studies. The relationship between stomach acid and chelate release is mechanistically clear. The B6 cofactor relationship is grounded in cell biology. The exact dosing precision for every individual is still being refined, and the right number for you depends on your kidney function, your medications, and your symptoms. What I am telling you tonight is what the best evidence supports, and what I see working in my clinic week after week. But I want you to know where the lines are. So here is exactly what I want you to do, starting tonight. Step 1. At your next refill, pick up magnesium malate or magnesium taurate, 200 to 300 milligrams of elemental magnesium per day, taken at dinner with food. The general safe upper limit from supplements for healthy adults is 350 milligrams of elemental magnesium per day, so this dose stays comfortably inside that range. If your stomach acid is known to be adequate, magnesium glycinate is still a defensible choice. Just take it with a meal that includes some natural acid. If you have severe digestive issues, add a topical magnesium chloride spray to the routine. Step 2. Add a P5P form of vitamin B6, 25 to 50 milligrams per day. Take it alongside the magnesium. This is the cofactor that decides whether the magnesium stays inside the cell or leaks straight back out. Step 3, and this is the part most people skip. Eat that meal with something that has natural acid in it. A piece of fruit, a salad with vinegar, a swallow of warm lemon water before the pill. If you take a proton pump inhibitor, an antacid, or a calcium supplement, keep at least 2 hours of separation between those and the magnesium. That is the part the pharmacy will not tell you. One important note: if you have any kidney disease, talk to your doctor before adjusting your magnesium dose. The kidneys are how your body clears extra magnesium, and when kidney function is reduced, the safe upper limit drops. This protocol is built for the typical adult over 60 with reasonable kidney function. Anyone with chronic kidney disease needs personalized guidance. Track 3 things in the first month: the number of nights with cramps, the time it takes you to fall asleep, your resting heart rate when you wake up in the morning. Those 3 numbers will move first. Cramps and restless legs usually respond within 1 to 3 weeks. Sleep quality settles in 3 to 6 weeks. The smoother blood pressure and the calmer baseline anxiety take longer. 6 to 12 weeks of consistent use. Pay attention to these signals. They are your body telling you the magnesium is finally reaching the cells it was supposed to reach all along. If you do all 3 steps and you still see nothing change after 8 weeks, that is a signal to ask your doctor about checking an RBC magnesium level and reviewing your medication list for hidden magnesium wasters. Diuretics, certain blood pressure drugs, and long-term acid blockers all pull magnesium out of the body even faster than your gut can put it in. Sometimes the fix is not just a better supplement. It is a conversation with your prescriber about whether one of your daily medications is the silent thief. You weren't doing it wrong. You were just never told the part that would make it work. Now you know, and starting tonight, you can fix it. If this video helped something finally click into place for you, do me one small favor. Write, "Starting tonight," in the comments below. I read them, and it tells me which videos are landing where they need to land. Subscribe because next week I'm covering the vitamin most people over 60 are quietly losing every single day. And it is the one that decides whether your magnesium ever stays inside your cells in the first place. You do not want to miss that one. I'm Dr. Richard James. I'm rooting for you every single step of the way. Take care of yourself tonight. You've earned it.